My topic study is health behavioral promotion among hypertension elderly applying health belief model. I have two topics to presentation. Firstly, introduction. Secondly, complications. Thirdly, control blood pressure. Next, health belief model. And finally, conclusion. WHO study found that hypertension was a significant problem globally. Hypertension is the leading cause of death and disability. Hypertension affects to 1.8 billion people in the worldwide. 50% of these people are unaware of their condition, and 25% of those who are aware of their hypertension do not comply with hypertension information in preventing and controlling the disease, and this results in 75% of the world hypertensive population being at risk of heart disease, cardiac arrest, and stroke, or even sudden death. Especially, hypertension is the main problem in the elderly. If the patients are not treated or maintained discontinuous due to the lack of a correct perception about the disease, hypertension leads to complications which affect to physical problems. Full-time study found that firstly, when blood pressure stays high over time, it can damage the body and cause complications. Some common complications and their signs and symptoms include hypertension, causes congestive heart failure, constrict heart artery, myocardial infarction, which then lead to heart failure. Other than this, hypertension leads to left ventricular enlargement, which then brings about heart cannot receive the blood from lungs. Effect are blood clot in lung. Alveoli in the lungs does not expand fully and makes oxygen decrease. If the patient is not treated, this leads to right ventricular working harder, which affects to edema and right ventricular failure. Moreover, complications of hypertension are impact to patient condition. There are complexity of hypertension, heart attack. Heart attacks is the result from the flow of oxygen rich blood to a section of heart muscle suddenly becomes blocked, and the heart does not get oxygen. The most common warning symptoms of a heart attack are chest pain or discomfort, upper body discomfort, and shortness of breath. Secondly, peripheral artery disease is come from plaque built up in leg arteries and affects blood flow in the legs. When people have symptoms, the most common are pain, cramping, numbness, itching, or heaviness in the legs, feet, and buttocks after walking or climbing stairs. Stroke will coming up when the flow of oxygen leads blood to portion of the brain is blocked. However, the symptoms of a stroke include sudden onset of weakness, paralysis, or numbness of the face, arms, or legs, trouble speaking or understanding speech, and trouble seeing. The cognitive change will occur when blood pressure is high. Signs and symptoms consist of memory loss, difficulty difficulty finding words and losing focus during conversations. The slide show related to complication from hypertension. Thus, hypertension is a serious problem disease that leads to multiple organ dysfunctions in older persons. Change the way of life and important role in treat high blood pressure. As Beckerman suggests that blood pressure can control regularly by correct the habitual health behavior and get the follow-up will be able to control symptoms and prevent complications. A critical step in preventing and treating high blood pressure in a healthy lifestyle. Patients can lower your blood pressure with the following lifestyle changes such as control weight, quitting smoking, eating a healthy diet, include the dietary approach to stop hypertension diet, reducing the amount of sodium, exercise at least 30 minutes a day, several days a week, and limited alcohol. I have some question. What kind of food suitable for hypertension patients?
Low salt.
And low calorie, low cholesterol.
Cholesterol.
Thank you for answer. According to Robinson, found that the public health efforts should focus on developing an intervention strategy that they should not only to reduce perceived barriers, but also increase hypertension management behavior. In Thailand, several nursing studies have approved available concerning how to control blood pressure. The study variable consists of self-care, self-efficacy, and self-management. I choose to use health belief model for manage blood pressure is optimum goal because this model hold that the patients have choice and are able to make suitable decisions regarding their health. Health belief model developed by Baker. He stated about health belief model concept consists of perceived susceptible, perceived severity, perceived benefit, and perceived barrier. Through the practical requirements to prevent disease, result in a change behavioral health is correct. First, they believe are susceptible to any associated disease or illness. People evaluate their chance of developing problems. The more vulnerable they perceive themselves to be, the more likely they are to take preventative action. Second, their perceive of the severity of the associated health problems. People consider how severe the consequences are of developing any problem with their health. The serious they believe this to be, the likely they are to take prevention action. Finally, the perceived threat of illness combines with the assessment of benefit and barrier to determine the likelihood of preventative action. For example, if a person feels threatened by ill health due to their sedentary behavior and believe the benefits of physical activity outweigh the barriers, they are likely to go ahead with it. On the other hand, if another person does not feel threatened or assess the barriers are too strong, they are unlikely to adopt physical activity into their lifestyle. Furthermore, science found that the health behavior score of hypertension patients was 23.8% of the patients had high score. The health promotion score was positively correlated with those of health conception and education level. The research study have suggested that health practitioners should promote the health conception and improve the health behavior of hypertensive elderly patients. Therefore, hypertensive elderly will able to control symptoms and prevent complications by applying health belief model. In conclusion, hypertension was a significant problem, especially as the main problem in the elderly. If the patients are not treated or maintained discontinuous, that lead to complications with effect to physical illness. The complications consist of signs and symptoms, include hypertension, causes congestive heart failure, myocardial infarction, which then give rise to heart problem to illustrate heart failure. In addition, stroke will turn up when the flow of oxygen reaches but to a portion of the brain is blocked or blood vessels in the brain is ruptured lead to paralysis. However, elderly people can control blood pressure by themselves. That it occurs from unaware of their healthy behavior.
ไม่แต่หนักนะ
Although a variety of studies have been used to control blood pressure, I choose to use health belief model for maintain blood pressure in optimal goal. For the reason that the health belief model will make the patient has health behavior promotion by their perceived susceptible severity, benefits and barriers to determine the likelihood of preventative action. As a result, future perspective in hypertension among elderly able to control symptoms and prevent complications by apply health belief model in their right to change behavior. Thank you for attention.